Hey everybody, it's Rukosa, the Boo Boss, and my new sign is up and I love it. So I've been fiddling with it, pretty much getting ready for this broadcast. So if it crashes and burns during the show, y'all gonna have to bear with me. I didn't have the hubs to help me put it together. But let's get into today's broadcast. I have two amazing practitioners with me, and we're gonna be talking about tongue ties. There's been a lot of information floating out there. I've had so many of my patients ask me, Ru, is it really a tongue tie? What is this tongue tie? Why are we talking about tongue ties? Why have we never heard about tongue ties? Then what do we do about the tongue ties? And I was like, well, I know two very phenomenal practitioners who can answer the question, what is a tongue tie? So without further ado, let's go ahead and bring in today's guests. And we have, hey ladies.
Hi. Hello.
We have BreAnne and Jennifer, and they're the co-owners of Pacific Wellness and Lactation. Welcome to Bumps, Babies, and Boobs, ladies.
Thank you. Yeah, thanks for having us.
Oh my God, my pleasure. It is such an honor to have you guys here with me, fellow nurses, business owners, girl bosses, just ruling it all today. Love it, love it, love it. So ladies, why don't you go ahead and introduce yourselves and just let everybody know who you are and why you're here and what we're going to be talking about.
Yeah, I'll start. My name is BreAnne Marcucci. I'm a family nurse practitioner in IBCLC and opened the clinic with Jennifer in 2017. Our clinic is called Pacific Wellness and Lactation, and we focus on perinatal care, really focusing on early lactation care. And then we also specialize in tongue tie release, moving to all laser release now since early this spring. My background is in family care. As far as nursing goes, my background is actually in lactation postpartum care. So that's kind of where I started off before I became a family practitioner. And then moved into Seattle, where I went into more perinatal care, lactation work, and then opened up the clinic here, which really is like our dream job. I mean, we get to work with families with new babies and help with breastfeeding. And then with our specialty now, we've really been more focusing on tongue tie and really oral tethers altogether. So other tethers, including buckle and lip tie as well.
Great. Awesome.
Yeah, I am Jennifer. I'm a registered nurse in an IBCLC, and like BreAnne said, we co-opened our clinic 3 years ago now. We're getting into our third year, which is super exciting.
Congratulations.
So I started out nursing with working with adult health population, so more acute and chronic health conditions in the home setting, and then I transitioned to inpatient and outpatient lactation and working at a large birthing hospital in the Seattle area before we opened our clinic here. Since opening this clinic, I've expanded my education and practice to including more craniosacral therapy and specialized training in infant body work to incorporate that modality into the care that we provide for our families here for both adults and infants. And yeah, like BreAnne said, it's a dream to be able to own your own practice, work with your best friend every day, and we're excited to chat with you.
A fun little tidbit is that we've actually known each other for years since we were children. So we've been friends for a long time, even before we became nurses. We both have young kids too. So that's been really fun.
Yeah.
I remember how BreAnne and I got to talking originally. I was getting ready to open the actual standalone clinic, where we are today. And I remember calling around and trying to find somebody who could just talk me through the process. I'm like, billing is a nightmare. Like, what do I do? What goes on? And I was like, do I need a partner? How does this all work? And you were so gracious. You took your time. You answered all my million questions. And apparently you still like answering my questions because here you are. And the one thing that stuck with me is just how you spoke of your partner. And you were like, Ru, hold off on getting a partner. Take your time, because finding that perfect match to build and bring into your business takes time. And Jennifer, she was just gushing about you. And I'm so excited that you guys have been able to build this amazing practice and that you continue to work together.
Yeah, it's been
fun. Learning process for sure in
Yes.
business development, because obviously it's not like we have backgrounds in business, so we kind of had to just wing it and learn as we go. Yeah.
Well, let's show everybody this beautiful practice, because you guys have a really, really neat practice. And I want to be able, before we start digging into what a tongue tie is, I just want to be able to show people what your practice looks like. So BreAnne, tell us a little bit about what are we looking at?
So right there, that's our laser room. Yep. So that first picture before was our laser room. Yes, there it is. So we use a light scalpel, all laser. It's a CO2 cold laser is what it is. And we like that room to be pretty too. So all of our rooms, everything is really light and bright. But that room is specifically just for the laser.
Got it. All right.
This is actually one of the midwifery rooms. We have a midwife practice that also shares space with us, Bayside Birth, that does an incredible job. There are licensed midwives that do community birth. So this is one of their spaces. We sometimes use this space as well. That is our clinic. So that's when you walk in. We have a waiting room area right there. And then we have a little waiting area on the other side of that platform there that is for kids. We have some fun chalk paint and some toys over there. Obviously not being used right now in the time of COVID, but
it is absolutely gorgeous, ladies. Congratulations on 3 years in practice and wishing you many, many more years.
Thank you.
All right, so let's dig into why you guys are here. So BreAnne, what is a tongue tie? What is, I mean, I diagnose them all the time, and every time I tell parents that I think your baby has a tongue tie or this baby has a tongue tie, there's this, fear that just falls over parents' faces, because I think they're hearing about this more and more. So what is it?
Yeah, it's a great question. It's something that comes up all the time. Clinically, a tongue tie is a piece of connective tissue under the tongue that has failed to recede by apoptosis. So what does that mean? It literally means that there's a strand under the tongue that has failed to separate in utero. That's really what it is. And when we're talking about tongue tie, we're talking about it in terms of restriction. So a tongue tie means that piece of strand called a frenulum or frenum is restricting normal motion of the tongue. And in our terms, when we're working with families, restricting it so much that it's causing nursing or breastfeeding problems.
Okay. So why, obviously this can't be something new, right? Why are we hearing more now about tongue ties? Why are we seeing them more? I want to say in my practice, maybe 40, 50% of babies that come in have tongue ties. What gives?
Mm-hmm.
Well, I don't necessarily think that there are more. I think that we as lactation work with a population that is struggling with their breastfeeding, right? It's not, we have the occasional visit where everything is going great. They just want to check in to make sure that everything is going great or confirm their thoughts that everything is going great. But when you work with a population that is having some difficulty and challenges, I think that's why we see a higher percentage of it. I think the statistics really overall with the population is about 8% of the population has this. But when you work with such a specialized group of individuals and families experiencing challenges, you're probably going to see it more if you're looking for it.
Some of the other reasons we're seeing it more or the prevalence might be increasing is we had a few generations that didn't breastfeed. So there's also that. So now there's more people that are searching for breastfeeding support, and we're finding, there's a tongue tie that might be impacting the breastfeeding. And then lastly, one of the clinical reasons that there might be an increase in prevalence is we're finding more and more about methylation problems related to folic acid that might be related to tongue tie. And that's currently being studied. So it'll be really interesting when that comes out. But it's in relation to a gene problem called MTFHR, and it's a methylation problem related to folic acid that can cause many different problems, not just for infants, or in utero, but later on in life. But we're finding connections to different midline problems with that. And one of them is the failed recession of the frenum in utero. So that could be related to the increased prevalence. But largely, right now at least, we attribute that to more people are trying to breastfeed than before. And then if you're seeing it more in your practice, it might be also because you work with breastfeeding problems. So it seems like more people have tongue tie because you're seeing the people that it's not working out well for.
Yeah, and that's what I keep telling people and providers, because a lot of times the pediatricians give me a lot of pushback. And it's like, oh, it's not a tongue tie. What are you talking about? It's never a tongue tie. Here we go again. You're calling it a tongue tie. And I'm like, listen, people don't come to my clinic if breastfeeding is going fine. They're at home, everything is great. Okay, they might come in for like oversupply or low supply, and sometimes low supply is attributed to tongue ties. So if I have a mom come into my clinic and I find a tongue tie, it probably is there because she wouldn't be having these difficulties if there wasn't a tongue tie. But how do you guys feel that? How do we better educate everybody, and how do we get all the providers on the same page?
I think a few things come into that. One is creating a standard way or using a standard way to assess tongue tie. That's one of the biggest problems, and why I think that we get conflicting information maybe from someone like a family's pediatrician, where they might say, oh, well, they looked in the baby's mouth and the baby could stick their tongue out. They said it was fine. But the big question is, well, did they look at the breastfeeding? Did they do a standard oral assessment? And there's a few really good standard oral assessments that have been evidence-based and proven to work really well and be really consistent. The one that we use really regularly in our office is the Hazel Baker. And it's an assessment tool that looks at function, appearance, and function. So that means that you have to look at how the baby's feeding, whether that's at the bottle or at the breast. And so one of the questions that I always ask if a family is coming and say, well, my lactation consultant said that the baby has a tongue tie, but I went to my pediatrician and they said, oh, no, they don't. Baby can stick their tongue out. I always ask, well, did they look at the latch? And I can tell you almost 100% of the time it's, well, no, they didn't look at how the baby feeds. And that's, I would say, one of the essential things to look out for. The other one is to look out for what we call kind of red flags. And that's just for providers that are in perinatal care to know too.
Yeah, and I think this is one thing that I love about your practice as well, because even though you release tongue ties, you guys are IBCLC, so you can help with lactation. So we're assessing it holistically, right? We're looking at the whole picture. Jennifer, you're doing body work, and I really want to, once we start talking about how we release them, about the aftercare, because it's not just about, okay, so we're going to snip, we're going to laser, and then off you go, everything is going to be great, right? There needs to be continued care and follow-up assessments.
Yeah.
Okay. So what is the procedure to release a tongue tie?
So in our office, we use laser procedure. So what we do, we put a little bit of numbing underneath the tongue or lip or wherever we're doing the procedure. We let that numbing sit there. It's a topical gel, so there's no injection involved, which helps to comfort parents too. So we put the numbing on, so we let that sit there for a few minutes. Then we gently swaddle baby up. We go right into our laser room. We gently lift the tongue with a little tool called a groove director. And then, so we lift the tongue, we lace that tissue with the laser, which it looks more like a pen. We lace that tissue. If we're doing both the tongue and the lip, we then lift the lip, we lace that tissue, and then we bring baby right over to mom to breastfeed immediately after. So the whole thing takes like maybe 10, 20 seconds. It's very quick. We're in the laser room for maybe 2 to 5 minutes.
Okay. And that's the frenectomy procedure.
Yes. Mm-hmm.
Okay. So BreAnne, up until earlier on this year, you were doing the same procedure, but you were using scissors.
Yes.
So
yeah,
why
so
laser? What made you change? What's the difference? What made you change to laser now in your practice?
That's a great question, and we get asked that quite a bit, especially when people are seeking the laser. We've been thinking about moving to laser for quite some time, and to be honest, the biggest reason is because the laser, through its mechanisms, there's very little bleeding. It doesn't quite cauterize, but it almost cauterizes while it does the procedure because it vaporizes the water in the tissue when it's lacing. And so the benefit of that is that you have a clearer field of vision, because the scissor procedure, it can be done very well. And I've done over 1,000 scissor procedures and had gotten better and better at those scissor procedures and do really good full release with a scissor procedure. That being said, there's always the cut and bleed, right? Yep. Which is not great for a field of vision to ensuring that you've done a full release. Also, it's not great for breastfeeding immediately afterwards, because babies don't like the taste of blood in their mouth, as well as the feeding right after. There can be a little blood in the way, as well as babies being upset about it. Now, as far as the actual procedure, to be honest, it really lies in the hands of who's doing the procedure. You can have someone do a laser procedure, but if they don't know what they're doing or aren't experienced, it won't be as good as someone who does an experienced procedure with scissors, to be honest.
I'm so glad you brought that point up, because I feel over the last year or so, there's so many providers doing laser procedures. I think literally just every block you have somebody who's doing a laser procedure. And as a lactation consultant who sees a lot of babies pre and post, it's not the same. It honestly isn't the same depending on who does the procedure. And there are times where even I'm like, okay. And it's really challenging. And part of the reason why I wanted to do this is to also educate parents so they know the questions to ask when they see that provider, and know that and be reassured that the provider knows what they're doing, and is going to take care of the baby appropriately.
Yeah, definitely.
It's really, lots of procedures going on right now. So we've done the go ahead.
Oh, I was gonna say, yeah, and something that we do a lot of releases after a baby has already had a release with another procedure or another provider. We do a lot of that kind of cleanup, as you would say. And one of the biggest things about that is the reason we end up seeing those families again to do another procedure is either the timing of the release was not optimal, and the lactation support was not there beforehand. That's one of the biggest reasons we end up doing a repeat procedure for someone else.
So when you say the timing was not right, what do you mean?
So a few things come into that. And one is we always do a birth history for baby. We want to know how that baby was birthed as well, because that plays a role in how they're opening their mouth or their jaw. Sometimes if a baby has a tongue tie, but it's not as visible, so maybe it's one of the posterior ties, like a type 3 or type 4 tie. Sometimes they need a little bit of suck training, body work, or even just work on back to breast before you release. Otherwise, that procedure is not going to be super effective, or you're just going to need to repeat the procedure because more is going to come forward. So usually a family comes in, they've been referred by a tongue tie. We do a full evaluation. So they get a full hour with us evaluation, no matter what. But sometimes they come in and they have been referred to tongue tie, but they haven't done some other things like worked on latch that would have been needed or had some body work beforehand. Mm-hmm. And I know by seeing that frenum, and this is from experience that I've had now as well, that more frenum is either going to come forward or that the problem isn't actually the tongue tie itself. There may be a tongue tie there, but the problem is equal. That's also going on is the baby also has a strong bottle preference for a fast flow. That's equally causing the issue with latch as the tongue tie. There's just multiple things going on.
And those are things that take an experienced provider who knows kind of what they're looking for when they're doing their evaluation.
Yeah, I think, and again, with you guys being IBCLCs, it makes such a huge difference, because I know in my practice, I only refer patients that I have seen. I will never blindly refer you to go and get a procedure, because I have a rule that I need to have done an assessment. We need to have milk. So we actually need to work on mom's milk supply. Yeah, because I'm like, if mom has no milk, doesn't matter if we fix the tongue tie, the baby's got nothing to drink. The baby's just going to learn how to feed on a bottle. So, and that's the thing that I feel a lot of times we forget. It's like, well, I just want to fix the tongue, and then I guess my milk will show up. I'm like, well, it doesn't quite work that way, because there's still a learning curve for baby. And what does the suck look like? Does the baby, what's the latch looking like? What else do we need to work on? How old is the baby? Are there any other issues going on with baby? I've had babies who come in glowing with jaundice, and we're like, let's go do a tongue tie release. I'm like, no.
Right.
Let's hydrate this baby. Let's take care of the jaundice. And then after that, we can address the tongue tie. But I think sometimes it's like, well, but now you want us to bottle feed, or you don't want us to breastfeed. I'm like, no, I'm doing this because I want you to breastfeed successfully.
Yeah, I think that also goes into, people think that these things are done over an extended period, but part of this is close follow-up. So it's not something, we're like follow-up in 3 to 5 days. It's not like 3 weeks, 4 weeks, 5 weeks. Like, these are things that take continued follow-up. And I think you draw on the important fact that it is nuanced, and there are a lot of things that go into an assessment, and having the unique ability as being IBCLC to look at both the mother and baby and know that the two are hand in hand, and we have to look at multiple factors. It's not just a thread of tissue under the tongue. There's a lot that goes into it. And so finding that experienced support is really important, and know that it's not, it may, sometimes it is like, that is what it is. It really is what it is. And that helps solve things. But even with that, there's going to be some aftercare and supportive care that you can give a family, but oftentimes it's not the fix all. So
yeah, I find I have to tell my families, I'm like, listen, we're going to see each other 3 to 5 days after, the release is done. And then again, a week or two afterwards to make sure things are working well. And the families that are like, oh no, we're just going to get done and we're going to go. They're the ones who call 2 weeks later and they're like, why didn't it work? And I'm like, I don't know. I wasn't able to check, were you doing stretches correctly? Was the tongue released correctly? And I think that tends to happen again when patients, when families go ahead and get a release without getting a lactation assessment prior.
Right.
And I think it's so critical that every baby that is going to get a tongue release gets a lactation assessment. I think the only time that I would say, and I wonder if you guys would agree with me, is when you've got a very obvious type 1 anterior tongue tie, like to the tip, that anybody can see.
Yeah, we don't see those because those are typically taken care of in a hospital.
Yeah.
So though more and more we're seeing them now, but I think that's just the general way of the world right now while we're in a pandemic. But yeah, typically we're not seeing those.
Yeah, I think there's a lot of credence to what you were saying, BreAnne, about the folic acid, because I know we're seeing a lot more. You're talking about how we're seeing a lot more midline issues from umbilical hernias, tongue ties, lip ties, inguinal hernias. We're really starting to see a lot of midline problems. And I have 2 sons, and the second son, Tana, my little rascal, he had a diastema. And when he was born, and a diastema, and we're going to show you what a lip tie looks like. His was far worse than the picture that we have, but his diastema cut all the way in his jaw. We're worried that, did he have a cleft palate? Like, what was going on? And I used to call it his stray hand. I'm like, I don't know about you, buddy. You better make like $3 million a year, because I don't know what's going to go on with that smile. It was just this big gash right in between his gums. And we ended up having to, get that lasered off, as well as a tongue tie, but he also had an umbilical hernia.
Yeah.
Oh, yeah.
Yeah. So yeah, I think there's definitely a lot to be said for folic acid, and I'm excited to see what the results of that study are going to be.
Yes.
So,
And when people bring that up too, we're always saying, yes, you should continue to have your folate in pregnancy. Obviously, that's really important to protect against neural tube defects. We're just learning what other things it might be associated with in its different forms for folic acid versus folate. Yeah.
Yep. All right. So now we've got parents who are concerned about a tongue tie. They think their child might possibly have a tongue tie. What red flags should they be looking for? So what are some of the signs, Jennifer? What would you say? Hey, parents, if this is happening to you, call us, come and see us.
Big one is persistent pain. If you've been working on the latch and positioning and you're having persistent pain, that is not normal. So that's a big one. A baby who has an inability to latch or sustain a latch, and an inability to sustain a latch without a nipple shield is a big one that we see. If you see or hear persistent clicking with a latch, that's not going away with positioning assistance. Sometimes what we can see later on is low milk supply and difficulty with maintaining good growth and weight gain in an infant. So those are all kind of some things that we see.
And those all relate to the latch too. So if the latch is persistently off because of the tie, those are kind of the results of them. Low milk supply, slow weight gain later on. So those are some of the problems that we can see.
Yeah. And I always say, if a mom is discharged with a nipple shield, she needs to see lactation. Like, the next thing you all need to do is go and see lactation, because I feel that's one of the things that's being done right now to circumvent us really doing a good oral exam and seeing, okay, why do we need a nipple shield? Is it really just the flat nipples, or is it that baby's having trouble establishing a latch? So moms out there, if you're discharged with a nipple shield, make sure you call Pacific Wellness and Lactation or the Perfect Push. Come and see us. We are here for you. Or if you're in pain, I kid you not, ladies, I've seen nipples with pieces missing because it's like, trying to feed a baby shark. And moms, with our heart, I see moms that are like, it's really painful, but they're breastfeeding, and I'm standing there like, oh no, we're not going to be doing this. This is not normal.
And with lactation support and tongue tie, obviously the basics are always just as important as the release itself. So with every family, we're always working on latch and positioning. Now, latch and positioning can fix a lot. If a baby has a true tie that's problematic, it's not going to fix everything with a latch. But the good thing is those same techniques or strategies working on latch and positioning really help along with the release. That's kind of like the next piece, but they're equally as important. And that's where what we like to talk about with our families is you need to have work on the latch and positioning so that you can get all of that comfort or help baby transfer milk, whatever the issue is.
I absolutely love that because I feel I do that in my practice as well. I'm like, let's fix everything else and the tongue tie will declare itself. So we get good milk supply, we get a good latch, we get good positioning, and you're still, got pieces of your nipple missing. It's still really uncomfortable. That's not the issue. Then we allow the tongue tie to declare itself. I've also found that I've gotten a lot less pushback from pediatricians doing that. Go ahead, Jennifer.
Oh, I just wanted to add in something just so that I didn't forget. The other thing that you should be seeing incorporated into that lactation care is tongue mobility exercises before you do a procedure. Because from a bodywork perspective, having some suck training and some relaxation of the jaw and neck and shoulders and all of this before a procedure is so helpful and so much more beneficial for a really good release. So having a knowledgeable lactation provider who is able to show you some suck training exercises that you can do beforehand is so helpful.
And then the other thing just to note is, sometimes people worry like, okay, we're going to go over all of these things. Well, if it really is the release, how long do we have to wait? Well, sometimes we do all of that within the 1 hour and release the tongue tie. We're not making people wait. We're just really doing a full evaluation because it's still a procedure for a baby and we take that seriously.
Yep, it's still a surgical procedure. So we have a question from Aaliyah, and she says, how important are the exercises or stretches after the frenectomy?
Yeah.
So exercises, very important. We get this question a lot, and a lot of families want a time frame for how long they have to do the suck training exercises. And I can't give a family an exact answer, right? We know that we expect to see some difference usually right away, more so over the first few days. Really full healing happens over 2 to 3 weeks after a procedure. And that is because it does take time. I mean, a baby practices sucking in utero for quite some time. And if they are practicing sucking with restriction, they have learned muscle memory with that tongue. So when you release the tissue underneath the tongue that has had restriction, it's going to take a little time for them to gain that new muscle memory. And every baby is really different in how long that takes and how that happens. So you do the sucking exercises until you're not having those symptoms, right? This is oral therapy and physical therapy for an infant. The stretching and aftercare, our recommendation is that doing those stretches. So everybody has, aftercare is a whole different topic because everybody has their own recommendations for aftercare. We tend to be really gentle in the mouth because we find that it's important that babies like to continue to eat and have things in their mouth. So being really gentle and aware of what you're doing with an infant is important. But we recommend doing those aftercare stretches while you still see that healing tissue, because that healing tissue is sticky and it wants to stick to itself. Now, babies are moving their tongues frequently throughout the day with feedings. The exercises that we recommend, or the stretching that we recommend, helps ensure nice linear healing so that we're getting a nice long frenulum and not something that's healing down on itself. And so I would say the aftercare stretches are important. The aftercare exercises are important.
Yeah.
And the way that we recommend doing these things is in a gentle way so that it's not traumatic for your baby. But it is an important part of the care. It's not just a procedure and you're done.
Yeah.
Awesome. So before we go to the next question, I just want us to show everybody what a tongue tie looks like and then what it looks like after we release it. And that way they can really get an idea what we're talking about when we talk about that diamond.
I do all my things.
As I can see, I was like, well, let's just show them what you're talking about. So, so this is a baby that has a restriction, right?
Yes.
So do you want to talk us through this a little bit?
Yeah. So
what are we looking at?
Yeah, this is a type 3 tongue tie. So you're looking at, so there's the tongue and we're lifting it up. And what we're seeing is we're seeing the webbing of the frenum, and it's attached right at the Wharton's ducts. Actually a little bit, this baby is a little bit through it, and it pulls the floor of the mouth up when it's elevated. And then there's actually webbing that attaches mid-tongue. So this is a type 3 tongue tie. So just because you see this doesn't necessarily mean it causes a problem. We would still want to look at the function of it on the oral exam when we use the Hazel-Baker exam, but we also want to see the function of it when the baby is latching. But just visually, you can see that there is the tongue tie. It's attached through the little Wharton's ducts all the way up to the tongue, midline on the tongue. There's webbing, and it's actually pulling the tongue down and making the tongue look fat. You see how it looks fat on the top of it versus like a thick tongue? So those are some of the signs that just with the appearance, we can tell easily this is a tongue tie.
Awesome. And then once you guys release it, this is what you're doing. This is the diamond, right, that you were talking about. So talk us through this picture as well.
Yeah, so once it's released, so basically we lace that tissue and it really opens up almost on its own once you release it. And we like to allow the body to open up as much as it wants to. So really we're just lacing a very small portion of the mouth there. We're not going into the floor of the mouth or into the muscle of the tongue at all. We're just lacing that frenum, and it opens up to be like a diamond. The diamond is almost like a gusset in sewing. So like the crotch of your yoga pants, okay? You know how it gives you flexibility? That's what that opens up like. And you see now the tongue has gotten much more thin on the top. It's able to elevate and cup more. And that is the goal for it post the release immediately.
Awesome. Thank you so much for talking us through that. Because I think it's so helpful for people to see, for our patients out there, to see what we're talking about. And then as soon as Jennifer did the diamond, I was like, okay, let's go to the picture so people can actually see, you know, what it looks like pre and post-op. I've had a number of infants that come to see me after they've had the procedure already, and no one ever told them about stretches and or suck training, any exercises. And those are the babies. And everybody says, well, but it was laser. They told me that there's no chance of it resealing. And so everything is going to be okay. What would you say to those families?
I would say every baby has their own healing. But every baby has their own healing, but the exercises and the stretches really do help in our experience. There's not a ton of great studies behind this, but we've done, over 1,000 of these procedures now. And what we can see is when people are doing the stretches, they have a lower rate of reattachment or resealing. So basically say that's the frenum, we lace that tissue. Here, I'll go lace that tissue. It opens up like this. All of the wounds are going to have a little contracture like this, and then it heals back into the new frenum. And so what it should look like for the parents is a big wide diamond originally, red for a day, then turns white. And then what they see with the stretching is it melts away. That's what it's kind of going to look like to them. And the stretches help it to heal narrow like that and open so that it doesn't heal like that. When it heals like this, it's like the tongue tie came back and can sometimes make symptoms worse. So stretches are very important. Again, we take a gentle approach. We don't want the baby super upset, because when they're upset, they guard their tongue and don't move it as well. We want them to move it freely. And we've had really good success with that.
So one of the other things that I want to talk about, and I know you mentioned this right at the beginning of the broadcast, is lip ties. And then you also mentioned buckle ties. Now, I have to be the first person to tell you, I remember I sent a baby over to get a procedure with one of my favorite providers. And they came back with like 8 cuts. And I was like, even I was like, what just happened? What's going on? So, yeah. And, I like to be measured a little bit conservative, but I will treat a tie that is a tie. We need to get that taken care of. But I think one of the concerns that I'm hearing a lot now is, okay, why are we doing lips as well? What are buckle ties? What's going on?
Yeah, and that's a valid concern. And we take the stance that we take two stances really, but the big stance is that we only want to treat a lip tie or a buccal tie if it's causing a problem. So the problem that it's causing would be persistent pain, inability to make a seal at the breast. So really inability to sustain a latch. It's one of the big things. So pain and not sustaining a latch are the big things that we see with this. And there's a certain way you can assess with that by looking at tension when you're actually looking at the baby on the breast. So again, if you're going to a provider and they're not looking at the latch, I would say that's not a full exam to determine if you need to release the lip tie or not. In releasing the lip tie, we see great benefit for babies that they're having symptoms because of it. And it's almost immediate with the lip tie, which is nice when it's a problem, immediate benefit. As far as buccal ties go, we always assess those actually in the laser room. So we tell families, okay, we found some buccal ties. What we're going to do, we'll release the lip tie and then we'll reevaluate. Because sometimes when you release the lip tie itself, it actually resolves. The buccal ties then are not symptomatic and there's no need. And I will say that's oftentimes what we find too. That being said, if there's a buccal tie, what you'll notice is there's residual restriction in the upper part of the mouth there, and it really makes it hard to make a seal. And so we'll release that if we need. But releasing so many ties like that at one time, not appropriate. And a reason why we feel it's not appropriate is because we take infant pain pretty seriously.
So, and I think it just rings true to what we've been saying all along is, does my baby have a lip tie? Maybe, possibly. Does it need to be fixed? Maybe, possibly. How do we know? We need to do a lactation assessment. We actually need to evaluate the baby sucking on the breast. Sometimes our babies that are sucking on a bottle and aren't going to be breastfeeding, and we still do tongue releases because they can't even hold onto a bottle, can't hold onto palate. They're making all sorts of kissing, smacking sounds when they're sucking. And when they do that, they swallow so much air. So, parents are like, my baby's so gassy and so fussy. And it's because that lip can't make that good connection and get that good suction.
Yeah,
and
if the baby is taking in air, it can exacerbate any underlying reflux. And that's one of the reasons we see many babies that are older than maybe a month or 3 months and older. Usually it's not because they're having persistent pain, because that's usually they come in earlier for that. It's usually because they're having problems with either weight gain or reflux. Yeah.
And if that's our tongue tie, let's look for the lip tie. That is a lip tie. So for anybody who's wondering, so what are we talking about? That is a beautiful picture of a lip tie. BreAnne, do you want to talk to us more about this?
Lip tie actually has some flexibility to it. So I would say this is one of our more flexible lip ties. I didn't have a picture of one of our others. This is a Cotlow type 2 lip tie. And you can see it's not quite making notching at the gum line. So when it's attached right at the gum line, sometimes it can notch it upwards and make like a little W in the gum line. That's a really restrictive tie. This is kind of medium on restrictive level, but this mom was having so many symptoms related to this tie. So we ended up releasing it and it gave her such relief, which was good. But you can see it pulls up at the gum line. It blanches white when you lift it up. This baby also has some pretty intense sucking blisters on the lips as well. That can be a sign of restriction because they're using their lips to help them kind of hang on to the breast too. So this was one that we found, had some flexibility, but ultimately we released it too.
Awesome. And this is what it looked like post-release.
Yes.
You can see nice and clearly it's that lip is lifted all the way up. So now this baby can really establish good suction on the breast.
Yes.
Yeah, and talking about that W notch, I wish I'd loaded a picture up of Tana because his diastema was real. It was very, very, very pronounced.
You're like, oh yeah, that's what that is.
All right, ladies. So what final thoughts? What is the last thing that you want people to know? What do you want our parents out there to know about your amazing practice, Pacific Wellness and Lactation in Everett? What should people know?
One of the biggest things that makes us unique, or that we feel makes us unique, is that we really take a holistic approach. And so you get to work with lactation as well as have a release, and usually same day as well. The other thing that's really important to us for others to know is that access to care is really important, and we are in network with most insurance and in network with all Medicaid plans. And that's something that we've worked really hard for. So people that have Medicaid, any of the Medicaid plans, there's zero cost on their part to come to our clinic and have our services as well as have a procedure done.
I absolutely love that. I think for a lot of families right now, the cost of getting the procedure done sometimes can be a bit of a deterrent. Um, Not long ago, I had a provider that I referred my patient to, and the procedure was upwards of $1,000. And I was talking to the provider, and the provider's like, "Well, is there really a cost to your child's health?" And I'm like, "No, but it depends on what's going on in your life at the time." And with everything happening with COVID right now, it's not necessarily possible, right, for everybody. It's heartbreaking, I should say, for parents to then have to kind of consider, like, what are we going to do? So, I'm really glad that you guys are offering the procedure, taking Medicare, Medicaid, and all insurances. And I think that, definitely it's awesome. So thank you, ladies, for doing this. Jennifer, any last thoughts? Anything else you want us to know?
No, I was hoping that she would touch on the access to care because it's kind of a passion point of ours. And I think that more and more, as more of these providers pop up and start doing this procedure, we just want to make sure that our practice is legitimized, because it's really important for us to provide this comprehensive care and really well-rounded care. And sometimes that can be overshadowed when you hear stories of families spending so much money on a procedure and without the other supportive care involved with it. And so when we started this practice, it was really important for us to incorporate lactation, to incorporate things like bodywork, to make sure that we are continually advancing our training and education so that we can provide families with the suck training, things like in between PT, OT exercises they can do before they can see a specialist, because sometimes those wait times can be long. So I think families should know that there are places that do comprehensive approaches to care, and seeking out people who are really experienced in what they do is really important. And that, again, I think we've touched on this a lot, that it's not just a procedure, that there are other things that you can do and that are involved. But yeah, access to care is a really, really big, important thing for us, especially growing up in the community that we're serving now.
And then the other thing, just for other providers that are out there, other lactation specialists, is we love working with other community-based lactation professionals, and we do lots of referrals back and forth. So we also have an approach where if someone is working with a lactation consultant they love and feel comfortable with, we are more than happy to take the medical approach and focus more on tie release, and then have lactation be supported elsewhere.
Yeah, I think I remember telling my husband, and I was like, "Oh my God, guess who I'm going to be talking to?" And he's like, "Wait, hold on. Aren't they a lactation practice?" I'm like, "Yeah."
It's like we love you.
Yes.
I know. And I just love that, we all do the same thing. We do it differently. You guys do so much more, especially with the releases, which I absolutely love. But we've referred patients to each other back and forth, because I think ultimately what matters is that our patients get the care that they deserve. And that's all we're all out for, right? We're in this for the babies and the mamas, and to make sure, that we have happy, healthy, growing, bountiful babies. All right. Well, ladies, thank you so much for coming on Bumps, Babies, and Boobs. It was such a pleasure having you. All right. So we're going to go ahead and sign off. Thank you so much for watching and for all the great questions. If we didn't answer your question, we're going to make sure that we go back into the chat and leave answers for you. Thank you so much for watching, and we'll see you next week.